Music has no boundaries.
Music unites us.
Pakistan Global Community.
चलता रहे ये कारवां.
Good evening to one and all present here. I have been presented with this wonderful opportunity to spread awareness on breast cancer by Pakistan Global Community, a global community that has actually initiated a step towards spreading the awareness of breast cancer in the society. October is marked as the month of breast cancer awareness. The pink month it is called, including efforts to educate those concerned to fight against cancer. The theme of this year 2023 is Keeping Her in Picture and Thrive 365, a woman's wellness being of utmost importance. Today I stand before you to address a matter of utmost importance, that is breast cancer. This relentless adversary has affected lives of countless individuals, causing pain, suffering and loss. But it has also ignited a global movement of awareness, support and hope. It is within this context that I wish to shed light on the significance of breast cancer, its impact on our society, and the importance of early detection and support. Breast cancer is not merely a health issue, it is a social, emotional and economic challenge that transcends borders and backgrounds. In the US alone, breast cancer is the most common cancer among women, affecting approximately 1 in 8 women during their lifetime. But it is not limited to women alone. Men can also be diagnosed with breast cancer, although it's less common. The impact of breast cancer reaches far beyond the individual diagnosed. Families are torn apart and communities come together in a shared mission to support and uplift those in their lifetime of need. In the time of their need. The emotional toll of breast cancer is immeasurable as patients and their loved ones navigate the roller coaster of fear, hope and uncertainty. This is why it is crucial to remember that support is not just a medical necessity but a moral support and a communal obligation. Early detection is our most powerful weapon in the fight against breast cancer. Routine breast self-examinations, regular mammograms and clinical breast examinations are essential tools that can help identify the disease at an earlier, more treatable stage. It is our collective responsibility to encourage these practices and dispel the myths and stigmas that can deter the individuals from seeking early medical attention. Remember, early detection saves lives. In the face of this formidable adversary, research and innovation are beacons of hope. Science and technology have made remarkable strides in understanding the mechanisms of breast cancer and developing novel treatments. Organizations and researchers worldwide are tirelessly working to find a cure and to improve quality of life for the survivors and the sufferers. Their dedication and persistence are testament to the human spirit and our commitment to conquering this disease. Equally important is the emotional and psychological support that individuals and families affected by breast cancer need. The power of community and solidarity cannot be underestimated. It is our duty to extend compassion, lend a listening ear, and offer a helping hand. For it is through unity and understanding that we can ease the burdens that breast cancer imposes. Breast cancer is a complex disease that occurs when abnormal cells in the breast tissue begin to grow uncontrollably. There are many underlying mechanisms that can lead to this, such as mutations, abnormal cell development and proliferation, tumor formation where the tumor can be benign or malignant. A benign tumor is non-cancerous and doesn't spread to other parts of the body. However, if the genetic mutations and uncontrolled cell growth continue, a malignant tumor can develop. This malignant tumor has the potential to invade nearby tissues and spread to other parts of the body through the bloodstream or lymphatic system called metastasis. It is important to note that while genetic mutations are significant contributors to breast cancers, many factors can increase the risk of developing the disease. These factors include genetics, family history, age, hormonal influences, lifestyle choices, and exposure to certain environmental factors like exposure to various radiations and toxins, etc. Early detection and regular screening such as mammograms and clinical breast examinations play a vital role in identifying breast cancer in its early, more treatable stages. We can also self-examine by palpating the breast by looking for abnormal lumps which might be the sign of cancer. There are different stages of cancer. Stage 0, it is non-invasive, that it has not spread anywhere else in the body but cancer cells are present. So there is a risk of breast cancer developing later. Stage 1, it is an early but invasive stage, that is the tumor has the tendency to spread to nearby healthy tissue or has spread to adjacent healthy tissues. These cancer cells spread around the breast, surpassing the area of origin. It can be diagnosed with early screening, but like stage 0, it is hard process due to absence of vital symptoms. Stage 2, the tumor is between 2 cm to 5 cm. Cancer cells have spread to nearby lymph nodes in the armpit. Stage 3, doctors call it as locally advanced disease because though the tumor has grown bigger than 5 cm, it has not spread to distant organs. Stage 4, this is the last and most dangerous stage. Cancer cells spread to distant body parts from breasts, likely to liver, lungs, bones, and even brain. Now, treatment once a patient is detected with breast cancer, it is all dependent on the oncologist to decide the treatment based on the stages. For stage 0 to 3, doctors treat with an objective of curing the patient. Stage 1 and 2, doctors perform surgery, and the aim of this surgery is to save as much as healthy breast tissues. This procedure includes removal of tumor and some of the normal tissue surrounding it, and a partial mastectomy, that is partial removal of breast that has cancer. If needed, doctor may advise for complete removal of one or both breasts. Any affected lymph nodes are also removed. Biopsy is done to check if cancer cells have reached the armpit. If any suspicion arises, a CT scan, biopsy taking 2-3 lymph nodes followed by MRI can be done. If cancer has spread to armpit lymph nodes, they are completely removed. If not, rest of the nodes are left. Then follows chemotherapy, that is combination of anti-cancer drugs administered. Hormone therapy, administering drugs that stop the hormone-sensitive cancer cells. Targeted therapy, drugs that specifically identify and destroy cancer cells are given to the patient either alone or in combo depending on biopsy report. Important, after these treatments, radiation therapy is started, continuing for a few weeks. This is very important to prevent recurrence of cancer again. Stage 3, chemotherapy is often given before surgery. This reduces size of tumor. When the tumor shrinks, it becomes easy for the surgeons to operate upon it. After surgery, doctors apply radiation therapy. The whole chemotherapy treatment is called neoadjuvant chemotherapy. It can also dismiss the need of surgery in some cases. Stage 4, for this stage, doctors focus on increasing the long-term survival rather than primarily curing it because it is a most fatal stage. In conclusion, breast cancer is a formidable challenge that affects us all. Now, by promoting early detection, supporting research, and extending our empathy, we can make a difference in the lives of those affected by breast cancer and work forward towards a future where no one has to fear its devastating effects. Thank you, Pakistan Global Community, and all listening to me. Thank you. Thank you so much.